The treatment of irritable bowel syndrome is what is low FODMAP diet. That is a treatment.
Yeah.
People who want to check low FODMAP diet will check out, put that in the description. What does low FODMAP diet contain? Lentils, legumes, dals, all good foods. It's and dairy. It's not like something very bad. Oh, avoid chips. It's low FODMAP diet is not chips. Low FODMAP diet is your regular food. And I am a gastroenterologist. I'm telling you, don't eat it.
Yes, very difficult. I was about to say that. I thought you'll
Don't
you'll
eat
stop
it.
the podcast because that's the first thing I do. Don't eat that first. Yeah.
No. The reason is these patients will not be able to handle it.
Handle it. Yes.
Because they don't have the gut bacteria to
To
digest.
handle it. Yes.
If you circle back, it's absolutely mind-blowing that if you would have taken all this FODMAP diet, high FODMAP diet to start with, you will not be in this situation at all.
True.
Because you didn't take that, you are developing IBS. Now, the good food that you are supposed to take, you're not able to take for a short period of time.
Yeah. I think that's what I said, that in the growing up years, or when you're post puberty, if you don't develop your gut microbiome and get bacteria, and at that time you're thulping cokes and pizzas, and you have changed your gut bacteria, and then then outside food, and if there is alcohol and smoking, if there is sleep deprivation, all of this is fairly common, doctor. Or you're going every day out, every third day having biryani and coke,
Ordering
on
all
all
the
the
apps.
apps. So this is where then the gut comes to a problem. It starts with a mild, I've seen it in my practice, starts with a mild acid reflux, mild heartburn, then food backing up, then palpitation, then diarrhea 7 to 8 times, then eating food and then within half an hour having cramps and wanting to go to the loo.
Right.
So when they come to this stage, then there is a very narrow scope to work with. Then every elimination and slow introduction begins. That's what I do.
The one that you mentioned, having food, you have cramps, you go to the bathroom, you feel better.
Very common.
Very characteristic of IBS.
Yes.
That is what IBS is.
Yes.
And when we say irritable bowel syndrome, basically it is high time that you repopulate your gut bacteria by changing your lifestyle. So that is what you were discussing, that legumes will have some difficulty initially, similar to the whey protein that you said.
Yes.
Initially, you need to figure out whether it is whey protein concentrate, isolate, what works
It
for you.
happens even with something as wholesome as eggs, doctor. See,
Eggs.
When somebody is consuming 1 egg a day, I cannot take them to 6 eggs a day immediately. They're not going to be able to handle that food because they don't have the requisite ability to handle that food. It is the same thing with fiber. If you're like 3 grams and 5 grams of fiber in a day, if I take you to 30 grams, which is what you will have a lot of gut distress. So say even protein, when bodybuilders, etc., or not bodybuilders, people who are into aesthetic fitness, they come to me and they say, I'm able to do only like say 70 grams. I want to go to 1.6 grams. Can we start tomorrow? I said, you cannot start like that. If you're at 1.2, you go to 1.3, few weeks 1.4. So I think everything is like that, but sure, there are some people who cannot tolerate certain kinds of food. Then okay, you can keep that away.
Of course.
That is
In my practice, so I say this to patients, 2 things will happen. One, the patient will come back next 6 weeks for follow-up. Sometimes they will never come back. Because either the problem got solved, or they went to a different doctor.
Great, yeah. That former, great.
But the person who's coming back in 6 weeks, invariably, they say that my symptoms are 50% better. Invariably. And it all takes time. It all takes time. Because all the damage didn't happen overnight.
Exactly.